I need to do this for him. I need to know that his death was not in vain.
Chris Cameron admits speaking publicly about her husband Frank's death doesn't come easily, but she's doing it in hopes of improving the healthcare system. Until last July, Cameron says her husband was in good health. He socialized regularly and was a volunteer radio host at Seaside FM. But on July 28th, he was taken to the Dartmouth General Hospital, where he spent 2 weeks after a fall at home. Frank would only spend the weekend at his apartment before having to return to the hospital because of continued pain, mobility issues, and confusion related to a persistent infection.
I was beside myself. I thought I had him home, and then I felt bad that I had to send him back. And at one point he looked at me and he said, "Why are you crying?" And I said, "I'm crying because I can't help you." And he said, "It's okay. It's okay."
It would be the last time Frank Cameron was at home. After a return to the Dartmouth General, Frank was transferred in September to the restorative care unit at Camp Hill. By November, his physical and cognitive conditions worsened, and he was placed on the wait list for long-term care. Cameron says her key concern at this point was keeping her husband out of acute care until a long-term care space opened up. Despite assurances that would be the case, he was moved to the Victoria General in early January.
I couldn't believe it because we had just met with the doctor the day before, and we had asked that question, if there was a chance that he might be moved to an acute care floor. And we were told no, he would still stay in restorative care.
Cameron says the care Frank received at the VG was insufficient. She says staff seemed ill-equipped to deal with a patient awaiting a long-term care placement and dealing with the onset of dementia. Things became dire on January 16th when Cameron learned Frank had another fall. Although she was told it was minor, X-rays would reveal a broken hip.
That was my biggest fear. It had come true. And I knew this was the end for him.
Frank Cameron died 4 days later. He was 85. Health authority officials declined an interview request for this story. In a statement, they said patient transfers are based on an assessment of each patient's needs and conditions with the goal of providing the appropriate level of care in the most suitable environment. While the unit at the VG where Frank was moved is primarily for post-operative surgical patients, the statement said it can care for other types of patients with access to all necessary specialty services. Chris Cameron had a meeting with health authority officials in May. Last week, she was invited to a follow-up meeting later this week that she plans to attend, but she's skeptical her outstanding questions about her husband's care will be answered. Michael Gorman, CBC News, Halifax.